Welcome. Thank you for joining me to talk about a look at online health records. My name is Jamie DuMont. I am the Director of Operations for the International Foundation for Gastrointestinal Disorders. This is my dog, Brandy. I recently took her for her annual vet visit. The following day, I received a call from the doctor providing the all clear on her blood results and to check if I had any follow-up questions. As I ended the call, it occurred to me that I don't receive a call from my doctor with my test results. Does that mean my dog is getting better service than me? In this time of self-service, it can feel like we aren't getting the personal service or information that we need. The reality is that we are, but in a different way, a way that requires action on our part as well. Welcome to the age of digital healthcare. A recent report in 2017 from the Office of the National Coordinator for Health Information indicated that 52% of the individuals were offered online access to their records. Of the 52%, 75% of them said that they could view lab results, medication lists, and office visit summaries. There were also other things such as allergy lists and immunization. At IFFGD, we decided to ask our patient community to participate in an online survey about their access and use of digital records. We had 102 respondents. Of that, 77% have access to online health records. Of that 77%, 89% actively use it. From the survey comments, we determined the highs and lows. What patients like is the easy access to their records, like lab results, office visits, and procedure visit summaries. The ability to review their bills. They can direct message their healthcare provider. They have the ability to request prescription refills, and they can share their record with other healthcare providers. And they can look at their record 24 hours a day and 7 days a week, and sometimes in the privacy of their own home. Nothing is perfect, so with the good, there is the not so good. What patients don't like is sometimes they felt like their healthcare provider was too focused on the data entry during their appointment rather than focusing on them. They found that when they looked up the information, sometimes it was incomplete or even inaccurate. Some of the systems were difficult to navigate. You can't attach files, so you can't upload x-rays or other things that you've received. And with any online system, there's often downtime and offline time. The different systems don't talk to each other. So if I have two healthcare providers that are using online systems, but they're a different system, they can't share information. And some people just felt like it's too impersonal to have that online thing. Having access is very important. Even with these challenges to your health record, access to your health record is important. Most of us take the time to review our credit file because we know it's important and impactful. It should be the same with our medical records. Access is important because you can verify your personal information, including your date of birth, your address, and your accurate insurance information. You can verify medical information, including your medical history, health conditions, and allergies. And you can review medical bills to make sure that you know what you're charged for and that it was accurate. The most important thing when you're viewing your health records is to report any inaccuracies so it can be corrected. Online record access can help. You have access to office visit summaries. You can see your medication list and request refills. You have your immunization history, which is sometimes important if you can't remember what shots you've had. You can see your lab test results quickly in most cases, and you can refer back to them later if you've forgotten what the results were. You can share your health records, not only with other healthcare providers, but with individuals if you choose. And you can communicate with your healthcare provider via a secure message. If you're ready to embrace your digital access but need help, there are options available. You can ask your healthcare provider if online access is available and where you can find resources on how to use it. Also, you can get the guide to getting and using your health records at the Office of the National Coordinator for Health Information Technology. Thank you for your time. I hope that you find this information helpful.